what are our rights to age in the community with our disabilities, and how are these rights implemented through services, money or support services in the community? What is out there, and how can we learn from each other in implementing these rights and getting access to policies and programs that allow us to age in the community? And that's the purpose of what we would like to talk about. And Judy, I'm sure you can add something from your personal experience and your perspective. By the way, would you like to introduce yourself?
Hey, hello, everybody. My name is Judy Heumann, and I live in Washington, D.C. I've lived my life in the United States. I'm a disability rights activist, and I've had the privilege over the course of my life to work at the World Bank and at the U.S. Department of State. And I also worked in civil society for about 20 years and then worked in federal government and local government. So I have a pretty broad understanding of many of the policies and practices. But I think one of the issues that's very important for me is the fact that when I started engaging in the independent living movement, I was really a teenager. We didn't give it a name until I was in my 20s. And I went to get my degree in public health at UC Berkeley and had a professor who was engaged on issues in the area of aging with a community clinic that was considered to be a progressive community health clinic for older people and was asked to serve on the board. And so that started in the latter part of the 70s. And I began to become more engaged on issues around aging and disability, in part because I realized one day that I had polio. I had come through a time when we had no laws in the United States and very limited laws around the world as it pertained to the rights of disabled individuals, the right to exist anywhere with any kind of criteria. And we had been working really hard in the US, and we're beginning to make communication with disabled individuals in Europe and countries like Sweden and Finland and others, where the disability rights movement or independent living movement was also beginning to emerge. And I was realizing that the systems that were being set up for older people really were mirroring the systems that we had been fighting against for many years. And some of the programs that we were seeing were for older people who had what's called dementia or more significant types of disabilities, no longer being integrated into programs where people could come and go, like for seniors, that they were, even if they were living at home, they tended to wind up in these segregated programs for people who had similar types of disabilities. And the model was really not the model that we were fighting for. So I was getting more involved with other organizations dealing with seniors and beginning to raise this issue, and was involved in helping to set up an organization called the World Institute on Disability. And we held a conference in about 1986 or 7, which may have been the only conference that was ever held on issues of aging and disability. Adolph, were you at that conference in Wisconsin?
Wasn't there?
Okay. But it was a unique meeting because it was a small meeting, about 30, 40 people. 50% of them were from the independent living movement. But even in the representation we had from the independent living movement, we also had individuals who would be considered seniors who had disabilities. And then we had 50% from the, in some cases, progressive organizations for older people like AARP and others. And the purpose of this 2.5-day meeting was to talk about our different philosophies around empowerment, looking at policies and practices that really were shuffling older individuals who were acquiring disabilities into more and more segregated settings. So I feel that one of the issues we need to be dealing with, in addition, obviously, to Title 19 of the CRPD and other pieces of legislation that exist within our own countries, we really need to begin to get people as they are getting older, not when they are older, to really begin to have an expectation that they have a right to live a life when they're 70 or 80, which is similar to the life that they've been living at 20, 30, and 40. And that the changes they want to make in their life should really be more based on their choices as opposed to limited policies and practices, but also limited perspectives of ourselves. And ultimately, that's the most important thing. We've seen that clearly in the independent living movement, or whatever people may call it, in any country around the world. When we, the people who are impacted by the work that's being done, are silent, don't speak up, and in fact, things get done to us. When we in fact speak up and start thinking and learning earlier and can be supportive of each other, then I think things happen more effectively. I want to underscore the point that Adolf has just made about laws that change when you turn whatever the magical age may be in your country or your state. But at the end of the day, we need to do away with this. But it's not going to happen unless we really are driving the engine. In order to drive that engine, I feel like we must also ensure that the independent living movement is truly more intergenerational. The CIL in California, the Berkeley CIL, and other centers in California really did, in many ways, start off working with groups like the Gray Panthers, Maggie Coons, and others who were very progressive and really agreed and believed in what we were talking about. I don't see those same coalitions as we had in the past, and I think it's essential. Learning from each other, training each other, pushing each other, I think can really make a difference over the next number of years.
Thank you, Judy. Thank you, Judy. Would the other speakers, panelists, like to comment on what Judy just did? Personally, I feel that the coalition between the younger and the aging community has to be much stronger. I don't see it happen here in Sweden hardly at all. These organizations supposedly representing the interests of retired people have apparently no interest at all to talk about disability. We have not been able to successfully make alliances. How is it in other countries? Can anybody?
I guess one thing as people are thinking, Adolf, and that is those of us from the independent living movement who are now older and need to play a more active role in organizations representing older people. I think it's important that we really look at getting on the boards of directors of other organizations and begin to push these messages forward.
Yeah. Okay, could I please ask Gerard to take the floor?
We also had a comment from someone in France.
Oh.
And in France, their systems are also quite separate.
Okay, so It's wonderful to follow Judy. The last time I spoke at a webinar with Adolf, I had my dog barking in the background, but he's no longer there, unfortunately. I just want to make 2 or 3 points. And the first one is kind of conceptual. It's about the difference, I suppose, between the overall American approach and the overall European approach, which interests me endlessly. And secondly, I'll just make a few comments on the intersection between age and disability, because I think this is quite fascinating. And then lastly, I'll make some comments on the need for us somehow collectively to be engaged in the process of drafting the Treaty on the Rights of Older People, because that's where all the action is. First of all, the big conceptual point. I've been endlessly fascinated by the contrast between the American approach to independent living and the European approach. By the European approach, I don't mean the approach of Adolf or ENIL. I mean the actual legislation, policy, the operational assumptions that our policymakers have. And it seems very much to me that it's not even a social rights approach. It's very much a mid-20th century social welfare approach that's all about targeting need. And there's lots of wiggle room there in how you conceptualize need, sometimes in a very patronizing manner. It's all about deserving and who deserves and who doesn't. And it's all about husbanding state largesse to make sure that it's adequately targeted, etc., etc. It's not the language of rights. Even though it might be framed as social rights, it's actually just social welfare entitlements. And a huge amount of baggage comes with that. It's so easy to, as it were, write off people, to target resources at them, but in a way that segregates them, institutionalizes them, and locks them out and places them at the margins of society. And I've seen how there's little awareness of that cultural baggage that comes with a social welfare stroke social entitlement mentality. I sat on the treaty body of the Council of Europe Social Rights Committee. There was almost zero understanding that the way in which social rights are delivered has implications for a person's deeper human rights or perhaps even civil rights. I could go into chapter and verse. I saw how in the EU regulations on the structural funds, people were, as it were, pretending to do the right thing, oblivious to the fact that they were actually marginalizing people even further in their societies. And I see it with my own daughter in how her access to independent living services in my own country is not perfect, to put it mildly. It seems to me that the breakthrough comes, the motivation to really recraft your social supports, to channel the funds positively in the right direction. It doesn't come from within the social rights mentality. It really comes from a civil rights mentality, which for the first time would label separate treatment, segregated treatment, institutionalization, which is only its worst form, there are many other forms, as a form of unequal treatment that begs justification, as a form of discrimination that prima facie is to be avoided at all costs. It really seems to me that that consciousness has never seeped into European social thinking. And once it does, that then becomes the trigger for meaningful change. We tried to change the ESIF regulations in 2013, and we're met with an avalanche of lawyers' tricks. And I won't give you chapter and verse, but what's really lying behind those lawyers' tricks is a lot of cultural baggage that does not see, that cannot see that the way we're spending this money is discriminatory. Mind you, if you flip it over to the United States, the civil rights perspective on its own is obviously not enough. You have to have a developed social model to put in place so that you give effect to the civil rights model. And going back to your point about litigation and law and enforcement, Adolf, the problematic with a thing like community living, independent living, is that it feeds off the non-discrimination norm, but it absolutely requires social provision and positive social targeting of resources. And unfortunately, that tends to be something that's not directly amenable to litigation, because that obligation is to be achieved progressively rather than immediately. And a lot of courts hesitate to actually jump in at that end. So that's just a big frame conceptual point about how we need to meet in the middle, how we need to meet in Iceland, halfway between the civil rights model in the US and completely refreshed European social model, which we simply do not have at the moment. It's not really a question of money. France is spending a lot of money doing exactly the wrong thing. It's really that they've never made that mental changeover to seeing segregated, separate treatment as a form of unequal treatment and therefore discrimination, and then reverse engineer the social model to actually fit that new insight. That's never happened in Europe. We're still waiting for our Olmsted. Second big point is really on intersectionality between age and disability. There was also the Toronto Declaration about 8, 9, 10 years ago, which was a fascinating piece of work, bringing together disability rights advocates as well as elder law advocates around the world, and I found it really quite revealing. And if you just Google Toronto Declaration on Age and Disability, you'll find it out there. It seems to me that the cultural baggage that weighs down how you approach disability within the social model is magnified many times when it comes to aging. That although people with disabilities may lose their quote unquote functionality, elderly people have those functions deteriorate naturally through time. I mean, the most extreme example to this was me in India, whereby older people are expected to eat less and less and sit more and more to the side and create more and more space for younger people. It's quite fascinating in the context of scarce resources. And it's fascinating too how notions of agency, making your own decisions, retaining charge of your own life, whether it's intimate decisions or financial decisions or other kinds of, let's say, property-based decisions in old age, there just isn't a cultural expectation that will happen. So what you have is the majestic generalities of the law, saying you're an individual in charge of your own life, mediated through a cultural prism that says actually you're less and less and less of a person over time. And therefore, why would you be looking for something like the right to live independently and stay in your own home and so on and so forth? And it's obnoxious to me that in some sense the humanity of older people is called into question. It's equally obnoxious to me that European policy is now fashioned on what's called new management philosophies, whereby if we have an ongoing challenge, like our aging demographics in Europe, the first response has to be a market-based response, and therefore the task of the government is to incentivize private market participants. And guess what? A lot of European governments are doing exactly that and giving capital allowances and grants and tax breaks to build institutions for older people. So it seems to me that as we've achieved a lot, well, maybe marginal amount in Europe. That's in danger of being thrown into sharp reverse by a lot of these fiscal policies in Europe, which are utterly oblivious to really human rights oriented philosophies. So it's as if you have a myth system of human rights in Europe, but then you have an operation system that cuts in exactly the opposite direction. Boy, oh boy, we need an Olmsted decision in Europe for both older people as well as people with disabilities. My last general point is that there is this ongoing process of drafting a UN Treaty on the Rights of Older People. We've been semi-involved in it. We had a conference about 4 years in Chicago that tried to draw out the lessons from the Disability Treaty for the drafting of the Treaty on the Rights of Older People. I think Eric has been involved in that process episodically, and I can't underscore enough just how important it is to be involved in that. If you look at some of the instruments that have evolved on the edges of it, like I think there's an Inter-American Convention on the Rights of Older People, you'll see that it speaks with a forked tongue when it comes to issues like human agency, legal capacity of older people in old age, as well as the right to community living of older people in old age. The one pessimistic note I would leave you on, although I'm not a pessimist, is at European level, it seems to be the case that most people are converging around the idea of community living, no institutions, no small institutions, no group homes, but some of the elder rights groups and indeed some of the children's rights groups seem a little bit more accepting of those exceptions. And that's something we have to work on to understand, not just confront, but you need to understand where they're coming from and then try and work out something that preserves our achievements going forward. Thank you very much.
Thank you, John. This is tough stuff you're talking about. There wasn't, I don't see the light in the tunnel yet. It seems that we have a lot of work in front of us, which, as you said, is not so much financial, but it's attitudinal resistance. Why don't we have an Olmsted Act here in Europe? The closest we have to that is actually Germany. There was a decision about 10, 12 years ago in Hamburg that stated that support services in the community have preference over services in residential locations. And that's been in the beginning, it was pretty much neglected, and recently I've noticed that it's being cited more often. But that's about the only thing I know of. How about other countries? Are you, Gerald, are you aware of other countries that have similar things that might be a future?
Well, just one quick comment. The Olmsted approach wouldn't exactly be the approach wouldn't exactly be the approach one would take under the UN CRPD, for example, because the Olmsted approach is squeezing the issue through the lens of non-discrimination. And the formula the US Supreme Court uses, to its credit, is that a person has a right to be placed in the least restrictive alternative possible. That immediately creates wriggle room for some exceptions that states have been trying to push and the federal government have been trying to push back, to its credit as well. Whereas the UN CRPD has a much more positive philosophy. about individuals flourishing in the community, and doesn't say to the least restrictive possible. It just says you have that right. Of course, the Achilles heel in the CRPD is that the most important parts of that, which are the social re-engineering to make it possible, is to be achieved progressively. It cannot be achieved overnight. And I think that's where the battle line is. Has Sweden gone forward? Has it retracted? By the way, under international human rights law, you are allowed to retrench as economic circumstances dictate. But there are legal principles that control how far and how fast that you retrench. And very few people are aware of this. And I wish the debate were around issues like this. We have very good legislation in Ireland, but our economic model let us down and we retrenched far too far. So that's the first thing. And the second thing I would say is there are some countries with some good legislation and policy in Europe, but I sense that the people who operationalize it still think in terms of social welfare entitlements rather than social rights animated by a non-discrimination norm. That's just a generalization.
We have a couple of questions, Adolf, for Gerard, if okay to read them out. The first question is by Ola Linder. How can arguments be made without getting too party political that public funds need to be allocated in order for countries to align with their human rights obligations, at the same time not to make the obligations seem watered out in the name of legal certainty and progressive realization? It's one question. And the other question is from Marina in France. Do you estimate there is an influence of French disability politics on European policies shaping?
I would hope that Gerard and other people have answers. I don't have any.
I'm not sure I fully. The first question. Oh, am I mute? Okay. You can hear me?
Yeah.
You're okay.
One to watch is Kata Devandas, the special rapporteur, did an early paper, very fascinating paper, which very few people have commented on the future of social protection and disability. And she cuts across a lot of these issues on the nature of progressive realization and bringing adequate amount of resources to the table and so forth. I'd highly recommend having a look at that. It's about 4 years ago now. The second thing to watch is the UN Special Rapporteur on Extreme Poverty is outgoing, Philip Alston. Well, he is an outgoing person as well, but he's outgoing from office. And he's done nothing on extreme poverty and disability, but it's highly likely the next incoming Special Rapporteur will make disability a priority. He's a Belgian colleague. I won't mention his name because it's not in the public domain yet. I do agree this whole issue of progressive realization is the central issue, at least in Europe. Maybe it's framed very differently in the United States, but at least in Europe, that is the key issue. And nobody is really engaging at that level so far. On the second question, yes, I do think it's not so much French politics. Well, let me roll it back. When we lecture to our East European colleagues about how they should spend their EU structural funds, the automatic answer is, why don't you allow us do what France is doing, okay? And that's a really hard one to answer because it demonstrates a level of hypocrisy about demanding one thing of Bulgaria and then tolerating another thing of France. Of course, the distinguishing feature is France doesn't draw down on the EU structural funds to do what it does. But nevertheless, it undermines the arguments for positive change in Eastern Europe that France continues to do what it does. And I heard, this is a personal view, I think the government probably would switch faster, but it's afraid of service providers, and it's afraid of other groups as well, but mainly service providers, possibly trade unions. And that's why I think working collaboratively with bodies like the European Network of Service Providers is very important to try and leverage French service providers out of the mid-20th century welfare entitlement approach. Sorry to hog the debate. I'll retreat now to my kitchen.
Well, thank you, Gerard. Eve Hill, you were pointed out by both Gerard and Judy as having done a lot of work around the Olmsted decision. That has been mentioned, the Olmsted decision, now several times. And I was wondering whether you could give us your view on, is that an instrument that might also be useful for other countries?
Can you hear me?
Yep.
Can you see me?
Yep.
Okay, well, that's too bad. Sorry about that. Well, everything's great here in the U.S. In the U.S., we have the Americans with Disabilities Act, which explicitly says that people with disabilities have a civil right to receive services in the most integrated setting appropriate for them. And the Supreme Court in the Olmsted case made clear that it means what it says. So the Supreme Court in Olmsted said people with disabilities have a right to receive disability-related government services in the most integrated setting appropriate for that person. Not most appropriate for the government, not most appropriate for the service provider, and it requires government jurisdictions to shift their services from institutional to community-based. And that integration mandate has been enforced for people with intellectual disabilities, mental illness, and physical disabilities, and in institutions like psychiatric hospitals, intermediate care facilities, adult homes, sheltered workshops, and importantly, nursing homes. But it hasn't been explicitly enforced on behalf of elders in nursing homes. And age isn't a disability, but the disabilities that often develop with age, and that are the things that push us to move into institutions, are covered by the ADA. So there's no legal reason it doesn't apply to the kinds of disabilities people develop as they age. Those are still cognitive, mental health, and physical disabilities. And there's no legal reason it wouldn't apply to nursing homes where elders largely are pushed into. But there are a couple of barriers that have kept enforcement in this area from really happening. And one is the societal mental block against civil rights for elders. I think Gerard really made this point. We here in the US seem to think that the disabilities that elders develop are just part of aging. So they're not real disabilities. And real disabilities are somehow either tragedies or something to be overcome. And we don't assume that the disabilities that elders develop are tragic, they're normal. And we don't think they're going to overcome them. And then our societal expectations of the lives of elders are very, very low. We somehow assume that we are just waiting to die. So we might as well wait in an inexpensive facility with all the other people who are waiting to die. And so, as Gerard said, the social model in the US hasn't kept up with the rights model. And while the US laws aren't written as if they're about who deserves what, they're implemented that way. So elders are not seen as capable and therefore deserving of integrated lives. And then while judges and juries, and the way we're a litigation focused society, the way we implement things are through judges and juries, they react with shock when we talk about a young person with a spinal cord injury having to live in a nursing home. But we seem to think that elders want to live with other elders. In my work implementing Olmsted, people have literally made that argument to me. But older people want to live together. I'm like, well, maybe, I doubt it. but maybe, but they want to live together with older people they choose to live together with, not just whoever the nursing home took in. And they'll argue on the other side that elders will face more isolation in the community than they do in nursing homes. So the cultural baggage that Gerard talked about is still here. Plus, there are two legal defenses to the integration mandate. Undue burden, meaning the services in an integrated setting would be significantly more expensive than institutional services, and nursing homes for elders tend to be relatively inexpensive. I think that's because they provide poor services and because people in nursing homes die early. That shouldn't be the basis by which we choose a service. And services in the community might be more expensive. Home modifications, for example. And then the other defense is fundamental alteration, meaning generally a government isn't required to create new services in its system. And many jurisdictions don't have any community-based services for their elders. So they'll make that argument. And then part of what a nursing home provides is housing. Many elders leave their communities because their houses are no longer appropriate for them, whether they're inaccessible or just too big or too expensive to maintain, and they're unable to find affordable, accessible, suitable housing in their communities. But the integration mandate from Olmsted is difficult to apply to the availability or affordability of housing, because housing is mostly not a government service. And the Olmsted mandate is focused on government interventions and government services. So even if government healthcare services move to the community, would the housing be there? And finally, the funding, this is all infrastructure based. The funding for elders care is different from the funding for younger people. Medicare, our primarily government funded mechanism for healthcare for older people, is less government controlled than Medicaid, and private insurance paying for private nursing home care is not the type of system that you can easily apply an integration mandate to. So even where we have the integration mandate that applies to elders, we have trouble implementing it because the groundwork hasn't been laid in terms of the societal expectations we have for elders, the cost and the service models and funding streams we have in place. There are some communities and individuals who are creating models, and they tend to rely on private payments and long-term care insurance plans, but these new models challenge those systems as well because they were designed with nursing homes in mind. So we have cohabitation models where you at least choose the people you'll live with and share expenses. We have village models where everyone contributes to a central fund and contributes their volunteer or low-cost services, because the services that force people into nursing homes are not really healthcare services. They're home modifications and driving. And you don't need a nurse to do that. Excuse me. And then there are visitability laws being enacted in some cities to focus on housing and making sure there's an accessible entrance and accessibility features on the first floor, so they could create more appropriate housing stock, but they don't address the affordability problem. Excuse me. So beyond the US, if you talk about moving the Olmsted principle beyond the US, I think that's really useful. But what you don't want to do is focus it on institutions versus non-institutions, at least in those places that haven't developed institutions, where family systems are still serving people in the community, often with no support. Skip the step of moving people into institutions and then moving them out, because that creates the wrong infrastructure. So it would be wiser to focus your Olmsted efforts beyond the US on not creating institutional systems, but supporting community-based systems. Those are my deep thoughts for the day. I've clearly depressed everyone.
Oh, thank you, Eve. Thank you.
I was just going to ask Eve, has the creation of the Administration for Community Living that draws together federal funds for disability and old age, has it made a real impact so far?
Well, it was definitely a good beginning, and I think they are doing the administrative. I've been pushing for this intersection of aging and disability for some time to make sure that the disability independent living movement worked for people as they age as well, and the Administration for Community Living's combination of those two things seemed like a very positive direction in theory. But if things go the other way, where our current models for serving elders go into the independent living movement as opposed to independent living concepts moving into the elder area, that's a problem. And that's what I'm worried is happening now, that we will revert to, well, this is all we can afford and this is all that people deserve and our expectations should be low. And that would be a real rollback. So it can go either way. And the other thing is, I think the disability independence movement, independent living movement really focused on not just the people who are easy to serve, but the people with the most significant disabilities. And if you start with the people with the most significant disabilities and figure out systems that work for them, that has a terrific trickle-down effect. Oh, I can't believe I said that. Towards people with less significant disabilities. If you start, and as we too often do in the aging area, with the people who are easiest to serve, it doesn't have the trickle-up effect that we want. So I think the focus on disability really focuses the mind on the most significant disabilities, and that has a more leveraging effect than focusing on the people with milder disabilities who are easy to serve. And that's another thing I worry about.
Lots of noise in the back. It's not my dog. Has the issue of group homes come up in the US? I mean, presumptively, group homes is not what Olmsted is all about. If you want to congregate by choice, that's one thing, but not to have a policy of group homes. But how does that overlay onto the elder context, or does it?
The concept of group homes hasn't been used very much in the elder context because I think elders' attitudes towards group homes are not positive. People with disabilities' attitudes towards group homes are not positive either, except that they're better than a giant institution. I think one of the things that you talked about earlier about agency, and we lose our agency as we age, or our agency is discounted as we age, that's really encouraging jurisdictions to skip the group home model for aging people, because you're not giving them the choice between the giant institution to which a group home is better. You're just going straight to the giant institution based on cost and low service. People with disabilities through the independent living movement have exercised more agency, have demanded more agency, and have gotten it. So group homes have been used as a model there. I don't think we really want group homes to become the model for individuals who are aging, but they need to speak up against the institutional model and provide as the model to use the independent living model.
Eva, I have a question. Can you hear me? Does the Olmsted decision enable any solutions that are not consisting of a dichotomy, either community living or residential, either small group ups or large institutions? Are there possibilities of phasing in more and more support as needed, as a person ages, regardless of the magical limit 65 or whatever it might be?
Yes, the Olmsted decision and the cases following it certainly provide for or allow for a range of different options that you move through as your needs change. It's just that virtually none of those options have been implemented by the state and local governments. So the options that are funded right now are in your house on your own and a nursing home. They haven't done the interim models or the interim possibilities. People themselves have created interim possibilities such as the villages, such as individually created cohabitation models, but governments have not. And I think part of that is because the government's not seeing itself as the creator of this system. It's much more a privately implemented system. And so we don't have a guiding force in this system right now.
Would the also be open for a gradual solution where a person, instead of moving from the familiar housing unit into something else, be able to stay with increasingly amounts of personal assistance hours? That would be my dream.
And certainly long-term care insurance, which is very expensive and hard to get, provides for that model where you can start by having someone come into your home, and then as your needs progress, you can move. And then some of the private providers of services have those kind of step-up models as well, where you start in what's called independent living, but it is on site, and you move into assisted living, and then you move into the nursing home. You do they exercise some control. They do limit your agency, and there have been allegations that they over prescribe you. They say, oh, you need assisted living because we make more money on that. Or you need the nursing home because we make more money on that. So there are some opportunities for problems in those systems as well.
I think the village that, or the villages that Eve was talking about earlier are based in the community and really arose from people who were becoming older. And I think in many ways were also people who were not poor but had some means,
right,
and didn't need intensive supports. So being able to come and help someone go shopping or do mail or various things that could restrict somebody if they can't do it. But they do no personal services of any kind. So there's no option for them to help people out. The other thing is, I presume they may be getting some small amounts of government money if they apply for support for the villages themselves, but they're not linked. And I think they have a lot of potential, in as much as if we could get the villages working more with the independent living model, they could in fact begin to become a supporter of what Eve has been talking about. I think one of the other issues with the agency over at our Health and Human Services is the people that are working in the Office on Aging, for example, I don't think really understand the whole concept of independent living. So they don't really understand what we're talking about. The independent living program is much, much smaller. And within the organization, it's really fulfilling pretty much a bureaucratic function of making sure, things are done according to law. It's not really an advocacy component, I think, was originally modeled because in part with the new administration, the people running it don't understand the issues either.
Could we move on and ask Eric to take the floor?
Yes, thank you very much. It's been a very rich discussion. My name is Eric Rosenthal. I'm with Disability Rights International. And we are an organization that has monitored conditions in institutions globally, and have really focused on fighting abuses where they are most extreme. And we started out early on focusing on psychiatric facilities. And one observation I can certainly say is that globally, many of these institutions that may have originally been designated as psychiatric facilities, the large old institutions of the past, are essentially turning into institutions for elders. We also found, in facilities, there's often a range in the same facility of children, adults, and elders all mixed together in the same facility. For strategic reasons, we began to focus more and more on children, in part because that's where the international attention and resources were. And if we felt that if we were going to leverage international resources for change, there seemed to be consensus that, with regard to kids, that's where you could make a difference. If you stop new admissions of children, if you get kids out as early as possible, you're going to have the maximum impact on their lives. The flip side of that is that the people left behind, the elders in institutions, there seems to be extremely little interest in responding to this population. In fact, I think that the problem is so vast, I'm unaware of any international authority or study that's even attempted to grasp the extent of the world population put away in institutions. There are estimates for children that it's 8 to 10 million children. Well, if we just look from our own observations, the ratio of adults and then elders, it seems like there are, in any country that I go to, 2, 3, 4 times as many elders in institutions as children. So if you extrapolate from those numbers, we're talking 40, 50 million people. I mean, we're talking about the influence of France on social policy. But if you were to say there are 50 million adults and elders in institutions, then the entire population of France, it's the equivalent. It's so absolutely vast as to be mind-boggling. And there's another issue that I think is important and worth putting on the table. When we visited these institutions, the abuses within the institutions, we see people tied down to beds, shackled. We see such high levels of medication that people are essentially being restrained through medications. And, when you think about it, if you're going to be keeping vast numbers of people all their lives doing absolutely nothing, how can you hold them unless you restrain them either physically or chemically? Even though these facilities are theoretically there for their protection, we often find that there's just a total lack of medical care. So there are extremely high death rates. People who look old are actually not old, and they're just dying off at incredible rates. I think that we probably have consensus on this discussion, that the solutions and the answers are independence in the community, that we don't want to talk about making better institutions or fixing problems in institutions. The priority is for every dollar spent, we want people moved into the community. We want people integrated into society. And yet I think that those abuses, the extent to which really torture is going on in these places, give a certain urgency to the fact that someone has to pay attention to this lost population that has been written off. And to the extent that Gerard mentioned the conflict in international law between progressive realization versus rights that can be immediately enforced. When you've got people denied medical care, tied down, restrained, I mean, those are the classic, inhumane, degrading treatment and torture, which should be subject to immediate realization. And so what our strategy is often built on, fighting those abuses in their most extreme as a way of kickstarting the reform process, that we think that we can use those to get the immediate attention of government to provoke change. I'd like to mention some examples of using that mechanism through the inter-American human rights system. Gerard mentioned that there's now an international effort to draft a treaty on the rights of elders. Well, we actually have now a convention in the inter-American system on the rights of elders. It's mixed in some regards, but in fact, the fact that it provides for helping countries implement these rights through a treaty-based model to take some of what kind of the best of what the U.S. model of the Olmsted, the idea that a right to community integration might be something that's judiciable, that you could go to a court, demand enforcement, and kind of move away from this as just a kind of a social welfare issue to an enforceable rights-based model is something that I think is valuable and that can be represented in these legal mechanisms. My organization has actually taken the stab at trying to use the inter-American human rights system to enforce a right to community integration. The backlog of cases has unfortunately meant that cases that we filed many years ago have yet to be decided upon, and we're sitting waiting for some of these decisions. And yet we've gotten enormous sympathy from the Inter-American Commission on Human Rights. We filed one of the first cases now 7 years ago, and we're hoping to get a decision on it in the coming year, the Federico Mora case from Guatemala. And there, the commission actually did a site visit to Guatemala and issued a public statement, a press statement. So we don't have a decision in the inter-American system, but the fact that in response to our case, we got a site visit by an international body that called for community integration is the first glimmerings of an international kind of version of Olmsted, of a enforceable right to live in the community. And the commission called for the community integration of people with disabilities from the institution. So that's a very positive development, very promising. The challenge, unfortunately, in what we've seen, in a way, kind of really represents some of the dangers that I think that we face in this reform process. The Federico Mora Hospital is a big, old, abusive psychiatric facility. And after the commission called for community integration, what did they do? The government of Guatemala, I mean, the good side is they said no new admissions of children to this facility. That's definitely a positive. And the second thing they did is they skimmed off some of the elders, and they said, we're going to integrate the elders into the community because they're easier to treat than everybody else. Most of their problems are physical and not mental. They're stable. And we can integrate them into the community. But what they then did was create large congregate settings in the community that they called community integration. And it's just really tragic. And it's something we talked about not reproducing the institutional models in the community. It's our greatest fear. I think, again, Gerard mentioned that in Europe, we've got some of this in terms of EU funding for reform, for group homes, for institutions, that is reproducing the institutional model in the community, and to see countries in Latin America doing the same, that we have to be very, very careful. These facilities may be physically located in the community, but if they're congregate settings where there's no individual choice, the idea that every person gets to choose where they live, how they live, the choice of where they live, and these kind of cookie cutter responses to the problem are not going to solve it. Looking towards these legal standards and what they might offer, there is some actually very good language in this inter-American treaty on older persons, because it does recognize autonomy, the right to determine their life choices, to make those choices. Its concept of capacity. Unfortunately, wish they had learned more from the CRPD, because instead of talking about supported decision making and support to make choices, it's as if they're supposed to get information that will increase their capacity. This concept of capacity is a kind of old world understanding of it. And so there's definitely language in there that is not as strong, that hopefully can be interpreted in light of the CRPD. But when we are dealing with the Commission, the fact that now there is a treaty that recognizes the rights of elders to include a right to community integration, a right to choice, a right to autonomy, and indeed the convention itself defines segregation from society as a form of violence. So I think that, I mean, there's some amazing language in there linking segregation and violence. It's certainly a pattern that we see wherever you go, that when people are segregated from society, they will be subject to higher levels of violence. But by the treaty linking the violence and the segregation, I think it provides some avenues for using some of those basic mechanisms of human rights protection that may be immediately enforceable to promote community integration. So I think that there's some hope, there's some models. I think that the kind of model of what we've learned from Olmsted can be reproduced internationally. And I also think that international law, using the CRPD and using the Inter-American Treaty, we can do better than Olmsted. There's no limitations as we have in the United States on fundamental alterations of the system. That kind of issue we don't have to worry about. It's framed in terms of positive rights rather than negative rights. So it's not just about treatment in the least restrictive environment. There's a more positive idea, a positive right to services. And again, looking at the Inter-American Treaty, that there's an affirmative obligation to create those services that will allow for community integration, choice, opportunity, autonomy. So phrasing it in terms of those positive rights gives us the benefit of both justiciability, both immediate enforcement, and implementation of positive rights. So I think it's a model to be looked at that we can learn a lot from. Unfortunately, I think only 7 countries have ratified it at this point, so it's fairly small. Guatemala, where we're litigating this case, has not ratified it. But interestingly enough, we're actually finding that the fact that it's an inter-American treaty, that some of the language in it can be used to interpret the requirements of the American Convention, which is the core treaty underlying the inter-American system. So as a guide to interpretation, it's valuable. And the inter-American system tends to like its own instruments more than it likes the UN instruments. So I think we've got some cutting edge possibilities through our Guatemala litigation, hoping to do the same for a case we've got pending right now in Mexico as well. I'll leave it at that, except to say again, the idea, the greatest danger I see is that reforms in the name of community integration risk reproducing institutions in the community unless we kind of really base them on autonomy, choice, and individuality. That problem of group homes that we talked about, and it's amazing to me that in terms of the tension between, we're concerned that the resources going to the children's community and neglecting the elders, but ironically, in most of my work, the very battle that we're fighting on deinstitutionalization of children is to not put them in group homes and to ensure that they have a right to family and live in a family context. Ironically, to have that reproduce with elders is a very real and present danger. So we should learn from that experience too, learn the common arguments about the dangers of group homes and of congregate care and the essence of, at least at the adult level, of protecting autonomy and choice. Thank you.
Well, thank you, Eric. You sound somewhat hopeful about the possibilities of creating inclusion in the community. But as you said before, that requires adequate services in place already in the community. Like previously we talked about housing modification, we talked about support services like personal assistance. What are the tools you see to pressure, to force governments to put these alternative or these mainstream solutions in the community in place to let the people come out of the institutions?
Right.
What are the tools?
I think public pressure, exposure, awareness. I think activists using the media to bring this to public attention. I think that's the most. You can have great legal standards, but unless the governments feel the pressure, they're not going to do anything. So the easiest thing, the exposure and the publicity, gets the discussion going. And then, circling back to what Judy said in the beginning, there has to be, it shouldn't be people talking about people with disabilities. The disability groups themselves need to be engaged in developing the solutions. Building alliances, I think, between the disability community, the elder community. We've been working in the children's organizations, the children's community, and the families. So the broad support of civil society for reform has to be there. So it's kind of top down and bottom up. I think that the legal framework, that's where we can have the most optimism, because we've got a better legal framework than we've ever had. And trying to use and implement that is the challenge. But it will not happen unless there's pressure. And so using the media to bring that to public attention is for us the first step.
So you do have the legal framework, but is it sufficient?
It's necessary, but certainly not sufficient. As I said, the political pressure, the citizen advocacy, the grassroots networks pushing for implementation. And certainly the problem, we lawyers love legal implementation, but waiting 7 years for a decision is just much too long. That's a lifetime. We can't wait. So we file the case, and then we start immediately banging pots and making noise and using pressure and organizing citizens. And so that's where we've really seen results come. The other area where we can have immediate impact is on the international funding. And it's essential that the dollars, the euros being spent in this area, our colleagues at ENIL, we're going to hear from Ines, and Validity have actually sued the European Union to stop the use of the European money to be reproducing institutions in the name of what they call group homes. The place where we can perhaps have the most immediate impact. If we can't convince international donors, who can we convince? We've got to get the international donors not to be too self-satisfied, thinking that making prettier institutions, calling them group homes is enough. We've got to take a unified and strong stand against those pseudo solutions and really insist on what true community integration is.
Thank you, Eric. Ines, I hope you can talk about the European situation and how we could try to see to it that the structural funds, good tax money, is not wasted on counterproductive, horrible purposes.
Yeah, I can say about what we've been doing, Adolf, providing. I prepared a couple of slides just as props, but you can move, Anne-Marie. Just to say as background how ENIL sort of started working more on older people with disabilities as well. It's because we've been for many years now part of the European expert group on the transition from institutional to community-based care. This group has been working with the Commission on trying to basically promote deinstitutionalization at EU level. And the group representing the older people in the EU, the main group, was a part of that group. but they were very much against the approach of closing down institutions, and they left the group. And we have noticed, just as we were pushing for EU funds to be used for the development of community-based services and for a ban on investing in institutions, they have been pushing hard to make sure that this money can still be used for residential care settings. And we were very surprised to be told by somebody in the Commission in the Disability Unit, which is actually the focal point for the CRPD. We were told explicitly that that we have nothing to do with older people. That why are we saying anything on older people? That these are non-disabled people and they don't have, they don't come under the CRPD. So, which of course we didn't agree with, and we said, of course, disabled people age as well, and a lot of older people are, the reason why people end up in residential care is essentially because they have some support needs, which they cannot be fulfilled at home, or they're not eligible for support services in their home. So that's why they end up in residential care. So that's how we started working more on looking more at the issues around older people with disabilities. And we made sure that we intervened also in this working group at the UN level, working on the treaty when it comes to independent living. So I think what I wanted to highlight in this sort of European context is quite interesting how there is this sort of two-track approach. So on one hand, we have the CRPD, which has been ratified by the EU and all the member states, and which applies to everyone, including people, to all disabled people regardless of age. We have also the European Charter of Fundamental Rights, which talks about the right to independent living for people with disabilities. Again, it doesn't say people with disabilities of working age, people with disabilities in general. We also have an explicit article on the rights of older people to lead a life of dignity and independence. So this is all very positive. But then when it comes to the policy level, it's interesting. There is this new social, agenda, the European Pillar of Social Rights, which is meant to make EU more socially, sort of more social, and to give people a whole set of social rights. So there, the relevant principle on people with disabilities talks specifically about people with disabilities in the context of employment, whereas the issue of home, of community-based services is covered under long-term care, which is not the approach that we necessarily agree with, because of course we're trying to move away from the idea of care, and the CRPD is about moving away from the idea of care to the idea of support. So in a way, in this sense, people with disabilities are also being pushed under this long-term care agenda, which is in general an area where the issues of older people are looked at the EU level. So I think that's quite interesting. There is also a working paper by the European Commission, where this is the only place where it's explicitly mentioned. It's intersectional in that it says that the Commission should, that the member states should put in place measures to increase the ability of older men and women to continue independent living even as they become frail or develop disabilities. So that's the only place. Now, in terms of the issues that we're dealing, you can move to the next slide, Selena or Anne-Marie. We've looked at I have it in front of me in case, there it is. So we've tried to look at all the as much as we could gather data, so at all the issues that are there. So as you said, Adolf, we are seeing that personal assistance is very much limited to people people with disabilities of working age. We are seeing that as people get older, their support becomes limited just to basic needs, rather than looking at their participation in community life and, you know, the quality of life in general. We are seeing as people get older that they do have to rely much more heavily on informal unpaid care. And of course, we are seeing that people are very much confined to the use of residential care as they get older because of the lack of community-based services. And here in quite a few countries, there is a big number of private care providers coming basically to close the gap because there's no other services offered by the state. We are seeing older people being placed under guardianship, and this lack of awareness among older people about the CRPD, and this is what we are being told actually by the older people's groups, is that, well, even if older people have disabilities, they don't identify as disabled. They don't want to, you know, be considered disabled. I mean, our approach is that, well, it doesn't really matter, but they should have the protections of the convention, whether they identify or not as disabled people. And this is also something that is relevant. I don't know how it is in other places, but there is also this whole debate about assisted suicide and legal euthanasia in many countries. And for example, in the UK, where I'm based, the independent living movement is very much against the idea of legalizing this assisted suicide because they see it as a slippery slope, of course, that disabled people will be pushed into ending their lives as a result of not having services available. And this is basically a cost-cutting measure for the state. In some countries, the independent living movement is not opposed to assisted suicide or legal euthanasia, like in Belgium, I think, and in Netherlands. So that's also quite interesting. We can move to the next. I wanted to bring up how the European Commission sees the issues affecting older people and older people with disabilities. A lot of the issues that they identify are the same as the ones we've identified, but they see deinstitutionalization as a problem here. So they're saying there is a challenge of insufficient availability of residential care across Europe, and they are saying basically deinstitutionalization should not result in the closure of institutions. So they see it as a problem, which again, as a couple of people now mentioned, then affects also how EU funding is spent in this area, because we are very much seeing resistance by the member states to the idea that they should not build homes for the elderly, nursing homes with EU funding. They're putting pressure on the Commission to allow that. And we believe it does have a spillover effect then in general, because, you know, as I said, we are campaigning very hard for at least the EU funding to follow the convention and to be used for, to facilitate independent living, whereas the member states are pushing against that. And we now have this infamous legal service opinion from last year, which says that it's possible to use EU money to build institutions, as long as this is a part of the process of the institutionalization, which we of course think is absurd. So I think just to conclude, because Adolf, you asked me, you can move to the next slide. Adolf, you asked me about any relevant case law. So there has been this case in 2018 against France at the European Court of Human Rights, Delacole versus France, where this elderly man was placed under partial guardianship by his daughter, by his adoptive daughter. And he wanted to get married at the age of 70 something. And and to get married, he needed the permission of his guardian. And she didn't allow it because she thought that, you know, he would be, it's against his financial interests or her financial interests if he got married. So he went, you know, he challenged this through the national courts, etc., and he ended up at the European Court of Human Rights. And the European Court found that the right to marry and establish a family benefited only those with full legal capacity. So it did not find that there has been a violation of his right to, you know, to get married, Article 12. And it focused entirely on this national procedure. I didn't consider the CRPD at all. So clearly they found that, I mean, it's an interesting decision, and this, I put a link to the analysis where they looked at, basically, they just found that, you know, he would be making a mistake. He's been acting a bit foolish by spending money this and that way. He has been drinking, and I don't know. So it's clearly because he was older. He did not have, you know, he did not know what he is doing anymore. So this is not a positive decision. So it takes us a little bit back on the issues of when it comes to legal capacity and the right to, you know, make choices and decisions about one's life. So just to conclude, I put some considerations from our end. You can move to this last slide, Anne-Marie. From our perspective, I think we need to do much more about raising awareness about the convention and independent living in relation to older people. And like Judy said, I think the groups representing older people do not include any disabled people at all, at least in their, not visibly disabled, at least in their, you know, on their boards, etc. So that's, whereas I think we as ENIL, at least we do have various generations, you know, among us, people of different ages, but when it comes to older people's groups, they're very much healthy, let's say, you know, old people, yeah, that there's no crossover with the disability movement. Then we have to look, it would be important to bring this whole area of long-term care in line with the CRPD, because it is also at the national level, it is a very much a two-track approach. Most countries, when it comes to older people, this comes under the strategies for long-term care. Now, whereas, you know, there are strategies, institutionalization strategies for people with disabilities, they tend to include older people who then come under long-term care. Also, in terms of deinstitutionalization processes, older people tend to be left behind in institutions. They're just seen as it's sort of too late to include them back in the community. And it's one of the reasons why some of the institutions remain open is to still keep these older people, you know, somewhere. Of course, they then also attract other older people who haven't been living in them in the first place. Then we think we need to, yeah, just like we are working, promoting the right to family for children, we need to make sure that policymakers understand that you cannot separate different people's lives like that. I mean, to cut it into pieces and then suddenly you are not disabled, you're old, and etc. There is for sure a bigger need to challenge both the use of EU money, but also perhaps in other ways to challenge the lack of community-based services in court. And I think it would be interesting also as a final point to look at this also issue as the independent living movement at the issue of assisted suicide, and to try to find a common position on that, because that is also, it is quite a dangerous development if suicide is seen as a way to, well, get rid of people, not put in place the needed services. So I think I would end here. And of course, you might come up with other questions, but this is in terms of our work so far on older people.
Thank you, Ines. Now,
I have a question. Sorry.
please go ahead.
So I think, you know, in the United States, there certainly have been attempts to try to bring together legal experts when cases are moving forward. And it sounds like this particular case is a really bad precedent. And I think not for now, but really being able to, whether or not, you know, was ENIL involved with this, with information at all being presented to the court? Was independent living at all involved in this case?
No, we were not involved in this case. No, we did not submit a third party. We were not just not aware of it. So, but it is a negative precedent, because there have been some more positive decisions before when it comes to guardianship, the right to, you know, legal capacity. So this has, in this case, the court has taken a step back, and it's that intersection between ageism, I suppose, and disability discrimination.
And Gerard, what's your thought on this?
Partly the court is kind of bringing to the surface the age of the document they're dealing with, the European Convention of Human Rights, which was fashioned in a completely different paternalistic age, let's say, in Europe. However, your 14th Amendment is even older than that. And even your Supreme Court could breathe some life into it. So I'm very disappointed with the court in Strasbourg. I'm not even very happy with their rulings on legal capacity. I think they could have struck out in a completely different direction, legitimately so. And I'm just wondering two things. Number one, it probably brings to the surface the need for some sort of tracking mechanism, so that somebody keeps track of these cases going through and alerts bodies like ENIL to do an amicus brief or something like that. But also, strategically speaking, I'm wondering whether we should be placing more emphasis on the European Court of Justice for the EU, rather than, and this is very ironic, rather than the European Court of Human Rights in Strasbourg.
Any other comments?
I'm really sorry. I have to catch a train. So thank you, everybody. This is great. And sorry. I just wanted to say this is a great group, and I hope over the course of the next year we can maybe look at doing something like this, bringing some of the advocates from the aging community together for some more serious dialogue.
Mm.
So thank you all.
Thank you, Judy. That was a very, very good suggestion. I'm looking forward to that conference. Bringing together the aging community and the independent living community. Because after all, in the long run, we all are in the same boat.
Some of us are sitting in it square and center. Bye.
Adolf, would you like to? There have been some comments. Well, we say bye to Judy, and thank you. There have been, I can read out some of the comments that arrived just before we wrap up. Yes, maybe I see that Eric had, Jared had a question for Eric about what is your experience, Eric, of working on this treaty on older people? If you have any comments.
There we go. Sorry to unmute. Well, you know, I was involved early on and actually have not been most recently, so I've slightly lost track of it. But one of the comments that another person made earlier, that I was amazed in some of the earlier discussions on the treaty, that when we talked about the threat of nursing homes and the right of people to live independently, that some of the advocacy organizations representing elders seem to be very committed to some form of congregate care for elders. And that was so deeply disturbing that it made me fear for the whole process. When we were working on the CRPD, we had, you know, the disability groups were pretty unifiedly progressive on these issues. And to have a portion of the community interested in this convention that opposed full community integration really made me afraid. And so, again, I'm a couple years out of date. I couldn't tell you where it exactly stands right now, but I think some really, and this is where more alliances, I think, between the disability community and the elder community would be really valuable. I think the disability community has an enormous amount to contribute to this process, and that educational process would be of value, whether or not we get a convention, but essential if we're going to be drafting language that moves this forwards and not backwards.
Yeah. Do we have any other questions, comments from the
there were a couple of comments from Germany. It's mainly about resistance to the institutionalization in Germany. So people, there's a problem of people living in institutions do not want to move out, even though there is a better legal basis for free choice and choosing where to live. And the other thing is another comment also from Germany, that independent living services are not available all over the country in the appropriate way, and it depends very much on where a person lives. And he has asked also if, Eric, whether there is any kind of research and studies DRI has done in Germany, but I think Eric replied that no, not as of yet. Sorry. And is another comment from France. The worst thing that since it was about the case, it was the worst thing that since it was a reform about the right to marry, did not resolve anything, and the situation remains the same under the new label. And this is what Eric stressed, the risk of fractious reforms. So that, and Jared has made a comment that the European Court of Human Rights is about 30 years behind the US so that's, we don't really have questions, more comments, but this is, I've gone through them now.
Well, I would like to take this opportunity to thank the panelists for being willing to make time for this, to contribute with your rich experience and give us a lot of material to think about. And we'll do our best to have a decent documentation of this, including the PowerPoints, your PowerPoints, especially Ines. So thank you, all of you. Thank you for participating. We had 32 people, and which is quite good because they almost stayed all the time. So
thank you, Adolf, for hosting. Really, you're playing an incredibly important role in the community by bringing us together. So we really
we are a whole group. We got a lot support and help initiative from ENIL. And I also like to thank our two interns, Selena and Anne-Marie, at the Independent Living Institute. And we hope to be able to count on your presence even in the future. Thank you so much for your important contributions. Thank you.
Thank you, everyone. And I will, is it okay to end the
Yeah.
webinar? Yeah. Okay, thank you. Bye-bye.
All right.